there, I'm Islip Supervisor Angie Carpenter, welcoming you to this edition of Supervisor Spotlight. And we are absolutely delighted today. It is Breast Cancer Awareness Month, and you'll probably be seeing this over and over, even beyond. But with us today, we have Dr. Sophia Fu, who is the Chief of Breast Surgery at Good Samaritan Hospital.
Hi.
Of Catholic Health, Good Samaritan University Hospital.
That's right.
Yes, yes, and you've been with Catholic Health and Good Sam for a while.
For quite a while, yeah. It's over a decade.
Yeah.
It's a really great place.
So
just
tell
like
us, if you don't mind, a little bit about your history, how you got into being who you are and what you do.
Oh, thank you. Yes. So, I've just always felt very empowered about taking care of my patients. I've always been a, surgeon who loves to do things with their hands to really see a difference, in what we do. It's sort of a personal journey of having family members deal with different kinds of cancers, and especially breast cancer. I've just always felt a very special bond to my breast cancer patients. It is one of the most treatable and curable cancers out there. So,
that's a very important fact that I really want to focus on, because so many times when people hear cancer, they panic and it's like a death sentence. Breast cancer is not.
Correct.
Especially if it's caught early, and that's why, self-examination and, detection and everything is so very important. And I have to say that, and this is going back over 30 years ago, probably close to 35 years ago, when this whole awareness and being able to talk about breast cancer started in West Islip. And Good Samaritan Hospital was very, very much part of it. There were two women who came to see me. I had a business in town, and they came to see me. I was involved in the chamber, and they felt very strongly about it, and it was Lorraine Pace, and Pat Nichols was her name, and they wanted to start this breast cancer awareness movement. And, Lorraine stayed with it. Ginny Regnanti is another pioneer that I remember from the beginning there, that then, when they came to me and they asked me if the chamber would, embrace what they're doing and sort of, give them credibility, I said, yeah, well, I can do that, but you need more than that. And at the time, Good Samaritan Hospital was very much in the forefront of wanting to do things in the community and really more hands-on with the community, and they've certainly excelled in that. But I directed them to the gentleman who was involved in community relations at the time, and they just took off from there. And from that, the Breast Health Center at the hospital, and you're there.
Yes, it's one of the first ones in the state, which is pretty amazing.
Yeah,
and
it really is.
Yes.
And at the time, they engaged the U.S. Senator at the time was Alphonse D'Amato, and he really took up the cause and helped get that word out that it's okay to talk about, and it certainly is treatable. And the coalitions that have formed at Southside also, they had formed a coalition. And just this morning when I had the TV on, they were focusing on a group of high school students from Massapequa who were doing a fundraiser for breast cancer. And it's just so commonplace now, and it wasn't all those years ago.
Yeah, no, definitely it's changed a lot. And, it's such a wonderful place being here, where there was the birth of this wonderful breast health center that has really helped so many people. And, really with that partnership with the coalitions, we're just able to offer so many more resources to the patients in our community, which is really wonderful. But like you said, early detection is really key, so really being out there and knowing and being aware of what's going on. That's why October is so important. Really kind of brings it out to the forefront.
Yep.
I just came from the Breast Cancer Summit, where there were wonderful speeches by so many survivors, and really just the difference of people just speaking about it so much more these days, is bringing awareness out there, because it could happen at any age, even younger ages. So it's so important even for younger people to know about this.
Also too, we have to focus on everybody, just assumes breast cancer women, but it does affect men. And when I was in the county legislature, and one of the legislators, Legislator Cameron Alden, a male, and he was very upfront about the fact that he had survived breast cancer as a male. And I think that really helps, when people are willing to come forward and share their stories. It makes everybody feel a little bit more comfortable.
Yeah, absolutely. I think male breast cancer, one of those that's very, under-recognized, right? Many men may not even realize that they do have breasts and that you could develop breast cancer.
Yeah.
So really being aware, and if you feel something, getting checked out a lot sooner. There are some people that belong in these BRCA families, where there's a genetic mutation that actually increases the risk of breast cancer in males specifically. And by knowing that, not only being more aware, but also maybe even doing some screening, that we're starting to do for these people can make a big difference.
Okay, well, we're going to take a little break and come back with Dr. Fu and talk about the issue of breast cancer.
You're watching ITV, Channel 18, Islip Television.
Welcome back to Supervisor Spotlight. I'm Angie Carpenter, Town of Islip Supervisor, and delighted to have with us today Dr. Sophia Fu, who is the Chief of Breast Cancer Surgery at Good Samaritan University Hospital in West Islip, in the wonderful town of Islip.
Thank you for having me.
Yeah, the hospital's been there a long time.
It has.
Yeah,
Very long history.
Very much a
Yes.
part of the community for many, many years.
Yes, definitely a very big dedication, and they are really expanding. So
Oh,
it's really
yeah,
up and
it-
coming with
it's-
the new patient care pavilion.
The new patient care pavilion is very, very exciting, and I know that when we had the presentation before the town board to grant the various permits and everything, we were very impressed by the scope of what was being proposed, the fact that actually it was all about quality of care and
Yes.
not about adding beds,
Right. It's
and
all new.
making the operating
Single
rooms more
person.
accessible,
Yes.
et cetera. So it just goes in keeping with the fact that the hospital's always been a very sensitive member of the community.
Yeah,
As
definitely.
they serve the community, they don't want to cause problems for the community.
Right,
So,
exactly.
But it's so exciting to see the construction happening, and
Yes.
it really is quite lovely,
Yes,
actually.
yes, the facade
Yeah.
looks amazing right now, so
Yeah.
it should be opening up soon, but,
Yeah.
all single beds, very private experience for
yeah.
patients, and
And that's important. That's important. People are vulnerable when they're in the hospital. They're sick. They're there for whatever reason. But to be able to have that privacy, to have their own space, I think
Yes.
is huge.
yes, exactly,
Yeah.
fully recover, and
And from what I understand, and maybe you know better than I, that there's going to be a brand new ER. And if you've ever had to go there,
yes,
oh my God, it's like Grand Central Station. I mean, so much is happening.
yeah.
Uh,
Most ERs are like that.
Yes, but to know that
Yes.
that's going to, change, and that operating rooms are going to be more closely located to the ER, and it just makes a lot of sense. It's going to be really, really exciting.
Yeah, it does really elevate the patient experience,
Yeah.
and also just makes it so much better for the coordination of care.
Yep.
Yeah.
And I think it makes it, the fact that they've done that really has to have a very positive effect on the staff, in keeping staff there, nurses, doctors, whatever, to be in an environment where people aren't complaining because they're in a nice space. And I think it's very respectful of the staff, and I think you feel that when you are there.
Yeah.
Anyone going into medicine, I think, has to be very, very caring, but you don't always get that feeling sometimes. And I will say that at Good Samaritan Hospital, there is that sense that they really care about you
They
and
do.
want to help you get better.
No, definitely.
Yeah.
I'd have to say, I've been to 31 different hospitals in my career.
Oh my gosh!
Yes.
What, did you one a week? I mean,
Been in it for a long time, but Good Samaritan kind of just takes the cake. There's just this extra level of care that I've always felt, with the entire staff, the nurses, everybody. It just really felt like a home. And so
Yeah.
I think that's why you get that feeling, at that
well,
hospital.
I've had family members, be in the hospital for extended periods of time, so did a lot of visiting.
Yeah.
And even the janitor or the, you know, the custodial staff that comes in will always say good morning, and they're always smiling
very
and,
respectful,
you
and
know,
very
yes,
caring,
yes.
always trying
And
to help out.
that really means a lot.
It does.
You
It
know?
absolutely does.
It
That's
really,
why
really does.
I take all my family there, and that's why we, stayed at
Yeah.
Good Sam.
Well, that's great.
Yeah.
That's really great. So let's get back to early detection.
Yeah.
I know that there are a lot of organizations that will sponsor like a mammography van, and but how important is that?
Oh, it's so important. I mean, we do have, all the different resources needed for all the imaging, which is really important for detection. But we do offer quite a few free mammogram screening events at our Women's Imaging Center. We actually just had one last week when we had our pink flag ceremony for the kickoff of Breast Cancer Awareness Month. So there's still another one at the end of the month on Wednesday, I think October 29th. So,
okay, great.
Yeah, so definitely important to get it out there. Anybody who's, uninsured, underinsured, this is all very helpful,
And in a very professional but caring environment.
Absolutely.
It's, in fact, I shared with the doctor earlier that when I was thinking about my schedule today and remembering that we were going to be doing this, it sort of reminded me that I really need to make an appointment for a mammography. So I will do that before the end of the day. And I would ask anyone who's out there listening or watching to, you have someone in your life, if it's not you, it's your mom, your sister, your kid, whatever it is, you've got someone in your life who probably should be having a mammogram, if not you. So when you're finished listening or watching, please make that phone call, make that appointment. It is so important.
It is,
so
absolutely.
very important.
Yes, and it's so great that October is that month that really brings it back to the forefront,
Yeah.
So everybody can be reminded it's that time again.
Well, we've had the pink flag ceremony. There are pink flags out in front of Town Hall, and I saw them, lining Montauk Highway, and it really, really does, make you stop and say, what's that all about? Oh, yeah, right, I've got to do that, hopefully, and that you follow through and do it.
Yes, exactly.
I'm curious about the guidelines for screening. Has that changed over the years, or can one push it if they feel like, sometimes you just have to pay attention to your body?
Yeah.
And if you feel like maybe you should, but you don't reach that threshold, what do you say about that?
Yeah, so it's been sort of a moving target over the years. I think the U.S. Preventative Task Force kind of had changed things over a decade ago when they had changed the screening age to 50. But most recently, just about a year ago, they went back down to 40, which I think is really critical and key here. Most societies, especially mine, American Society of Breast Surgeons, American College of Radiology, American Cancer Society, we all believe that screening at age 40 and continuing annually is really important. But not just that, there are women that can get breast cancer even younger than age 40. So
we hear about it all the time.
Yeah, and actually just recently, the American College of Surgeons has released, data that there has been an increase in the number of women being diagnosed under age, 50 in general, but that is all comers, 20 to 50, right? So that's kind of also what's important about breast awareness, self-awareness of what's going on with your breasts. If you feel a little something that feels abnormal, any skin changes, dimpling, nipple discharge, anything on the breast that is a little different from the month before, that's really the key to say, hey, let me go get that checked out. And maybe at that point, needing a mammogram or an ultrasound to better delineate what's going on is important.
So, I mean, I think it goes back to paying attention to your body and being self-aware, but also too, there was something recently that I saw, someone at age of 30, who wound up having the BRCA gene. So if you don't reach the guidelines for getting that initial mammogram to have it covered by insurance, say, what about testing for a gene?
Yeah.
Is that something that people could routinely do at age 20, say?
Oh, absolutely. So family history is an important topic because that is one of the risk factors for breast cancer. Out of all breast cancers, maybe only 15% are related to family history, maybe only 5 to 10% related to a genetic mutation specifically like BRCA or some of the other genes that are out there. Definitely knowing your family is important because that's going to maybe flag you as somebody that's high risk. And in that situation, you might go for genetic testing just to see if you have a mutation that could be causing this, or perhaps seeing a breast surgeon to evaluate if you fall under this high-risk category before we might start screening even earlier than age 40. So typically, high-risk patients may start as early as 25 even, with screening.
Well, I have heard of cases of people younger,
Yeah.
than 30 having been diagnosed with breast cancer, and the fact that they were able to get in there early
Yes.
made all the difference in the world.
Absolutely.
You
It's a
know,
lifesaver.
You don't want to hear about people dying of breast cancer.
No.
There
It's so
is
treatable
no
these days.
reason for that to happen.
Exactly.
No.
And really, that's
So-
why early detection is really key,
Mhm.
because at earlier stages, you do so much better. So much less treatment is needed, and your prognosis is just so much better.
What are some of the warning signs?
Yeah. So kind of what we were saying about if you felt like a little mass on your breast, or you see some sort of skin changes, or maybe nipple retraction, some nipple discharge, redness of the skin, potentially lymph nodes that you might feel in the axillary region or kind of in the neck region. Those are all signs to say, hey, maybe something's going on. I should get checked out.
So is there any time of the day that is more conducive to testing, or maybe, in the shower in the morning, or,
Certainly, a lot of people do it in
Yeah.
the shower,
Yeah.
to take a look. That's a good time to also look visually in the mirror to see
Yeah.
if there's any changes. And, just kind of standing in front and putting your hands in the position of, on your hips and then up in the air, kind of just changes the way the breast lays.
Oh,
That
okay.
might actually help you to see if there might be a dimpling or something that, draws attention into being checked out.
All right, well, that certainly is a good tip.
Yes.
And I think if you can kind of just get into the routine of doing it,
Yes.
when you take a shower,
Yeah.
it seems like it would be the
But
easiest
not too
way.
often, once a month is really the ideal. If you do it too often, you may not be as sensitized to it. You may miss something. So once a month is good for those that are still menstruating, maybe day 5 to 7, after the first day of your period would be where there's the least amount of changes in your breast to really detect that.
Okay. Well, that's really good advice, and we do appreciate that.
Yeah.
Self-exams, we're talking about that. That's basically, obviously when you go to have that appointment with your gynecologist, you're going to have that breast exam. But it's something, again, are you saying monthly the self-exam should take place?
Yeah, monthly on your own, a self-exam or self-awareness. That's what's going to help you to identify something sooner than when you see your doctor, because you're probably not seeing your doctor
True.
more than once a year.
Right.
And sometimes there can be cancers that develop within the year, and you definitely want to be able to catch that much sooner than waiting the whole year to see your doctor.
Okay, well, we are going to take a little break here and be back with Dr. Fu to talk more about breast cancer and awareness, and hopefully someday a cure.
You're watching ITV, Channel 18, Islip Television.
Hi, welcome back to Supervisor Spotlight. I'm Angie Carpenter, Town of Islip Supervisor, and absolutely delighted to have with us today Dr. Sophia Fu, who is Chief of Breast Cancer Surgery at Good Samaritan University Hospital in the town of Islip.
Thank you.
Welcome back.
Thank you.
Yeah. So we spoke a little bit about self-detection, self-exams, etc. Can we talk somewhat about the risk factors?
Yeah,
I
definitely.
would guess some women are more prone to
Yeah, there are
developing breast cancer than others. What are some of the risk factors?
Yeah, well, we had just spoke about family histories. That kind of plays a role in it. But there are a lot of things going on with obesity these days,
okay.
and that role in increased risk of breast cancer. So there's a big movement in exercise oncology and really trying to reduce one's risk, factors. Exercising 30 minutes a day, 5 days a week, could be helpful. Losing any amount of weight that you can to get to a normal BMI would be helpful. Smoking, we know, is also a risk factor, so definitely no smoking. And
Well,
then
smoking seems to be a risk factor for many,
for a
many
lot of
diseases.
exactly.
And it shouldn't be something anybody is doing.
Yeah.
And I know many, many years ago, it almost seemed in vogue to be smoking, to be a smoker. But I think the pendulum has definitely shifted and
Yes.
changed.
For sure.
And now you wind up looking at somebody smoking and thinking, what are they doing? So hopefully it'll stay that way. And I don't know what the statistics are about young people, but it seems that for a while there, many, teenagers and high school kids were starting to smoke. And, it just seems so counterintuitive with all of
Right.
the education that's been out there.
Yeah, I
But,
think we're definitely making a big push to stamp that out. So
Yeah.
hopefully,
So
it'll
you've
be gone
got
one day.
obesity as a risk factor, and obviously it's a risk factor for other things, blood
Yes.
pressure, heart disease, et cetera.
Diabetes and yep.
Yeah.
Mhm.
So are there any other risk factors besides?
Also alcohol. You
Ah,
want to moderate
okay.
your alcohol use, and then also hormone therapy. They've noticed. Back when it was very popular to give hormone replacements for menopausal symptoms, that there was actually a link with breast cancer. So these days,
that's
it's a
interesting.
topic to, maybe not have hormone replacement therapy.
Very interesting.
Yeah.
So, in addition to the risk factors, identifying them, and the fact that you're doing self-exam, there have been some advances in diagnosis. So perhaps you can share some of that with us.
Yeah, definitely. Well, we know ever since mammograms came around, that has really decreased, the stage of the cancer that's diagnosed. And as we said earlier, that really leads to much better prognosis, less treatment. The mammogram itself has changed over the years. So now, routinely, most places are doing tomosynthesis, which is 3D technology, where instead of looking at a 2D photo of your, squashed breast, they actually look at different 1 millimeter slices, so the radiologist can look in and out to see if there's truly a finding or not.
Oh, that's interesting.
Yes, which is pretty amazing. And in addition to that, there's, artificial intelligence is a really hot topic these days. And so a lot of software companies have studied how to use artificial intelligence
To
to detect breast cancer
Wow,
better
that's interesting.
than just having, the naked, human eye. And so that has really started to, come to the forefront. A lot of us are starting to adapt artificial intelligence into these radiologic practices. Good Samaritan has, started with one of these
Oh,
software
that's great.
companies, which is amazing. Ultrasound is also very helpful for people with dense breasts. With dense breast tissue, it just looks at things a different way to be able to identify things a little better. And then MRIs have really made a big difference in breasts as well. Using a little bit of contrast, it lights up the breast and shows us activity in addition to what things look like. So it's usually safe for our patients that are high risk, like we had talked about before.
Right.
And potentially using that, we can identify cancers super early, maybe even at stage 0 or even pre-cancer,
Oh, that
which would make a big difference
does-
in the long run. Yeah.
Wow, that's really quite interesting. So you have all of the preventative, hopefully, the self-diagnosis, the diagnosis advancements that have been made. So what if someone ultimately gets that diagnosis?
Yeah.
What do you say to them?
Yeah, I always start off with breast cancer is so treatable and curable these days. And there's so many different things that we can do to help you with that. It's a very multidisciplinary approach these days. Breast cancer, just research has gone into it so much that we're able to really personalize our treatment these days. So each individual comes in and we talk about the different treatment options. Usually surgery is the main option to remove the portion of the, the cancer. We try to conserve breasts if we can. Some people may need a mastectomy. With either approach, we're able to do reconstruction to kind of help make the patient feel whole again. So if we take out a portion of the breast, we could do what's called oncoplastics to move tissue around to kind of fill it in so you can have the better appearance of a normal breast. For those that undergo mastectomies, some patients can undergo what's called a nipple-sparing mastectomy, so we're able to preserve the nipple and the areolar complex. We can pair that with flap reconstruction using our own tissue to kind of fill it in to recreate a breast, and even potentially doing what's called nerve grafting. So traditionally, when the nipple-sparing mastectomy was done, there would be no feeling of that nipple areolar complex. But nowadays, we could potentially identify these nerves, preserve them, and then perform a graft to the nipple areolar complex to regain sensation. So we've actually made a big difference in the quality of life for patients, since we have so many survivors these days.
Wow, that really is quite remarkable. And all of this is happening right here locally.
Yes, absolutely. And even more so, we're starting to look at minimally invasive ways to treat breast cancer. So cryoablation has been around for a while. It's the freezing of tumors. We were actually the first on Long Island to do cryoablation of benign tumors. But just about 10 days ago, the FDA approved its use for malignant tumors in elderly patients. So now we're going to be able to offer that to patients as well.
So tell me again, what is that term?
cryoablation. So it's
Cryoablation.
using a probe that creates an ice ball and it freezes the tumor cells and kills it. So instead of having to go for surgery to remove it, freezing could just be done for it.
Wow, that
Which is
is
pretty
really,
amazing.
really amazing. And this
Yeah.
is just recently.
Yep, just recently that it got the FDA approval, which is
Well, you
which is
heard it
great.
here, folks.
Yes.
Right here in town.
Yes.
So with these treatment plans, are there those that opt to do nothing?
There are some that may not want to do anything. Usually, the best thing is to treat the cancer because people do so well from it. You know, if left untreated, it could get more advanced and spread. You know, and patients will ultimately die from it. So. There are some alternatives where we've made a lot of progress in the way that we treat things from a whole body approach, so systemically.
Okay.
So there are some cancers that are sensitive to hormones, so maybe just an anti-estrogen pill may be helpful, especially in our older patients. That's actually used for adjuvant treatments, meaning in addition to our surgery for most patients that have estrogen-sensitive breast cancer. We've made a lot of advances in chemotherapy and even immunotherapy, so there's other patients that may need those therapies that we could really individualize for them. So things have changed a lot.
I would imagine that this is an area where the coalitions can really be helpful.
Absolutely.
If you have someone who is first getting the news, doesn't know how to handle it, may just want to ignore it, you know, make believe it's not happening.
Yeah.
They're really hands-on in that respect.
They are, definitely, and we're so blessed to have so many of them in our area. And I think it's really helpful that we have so many support groups as well. Even, you know, Good Sam, we have a support group, and that really helps with people to kind of understand, you know, what's going on, and that there's other people like you that are going through or have gone through this, right?
And I would imagine that someone who has gone through it, hearing it from them, and especially having a positive outcome has really got to make a difference.
Yes, it definitely does. Yeah.
And I know the coalitions too are very helpful when people are going through chemotherapy or whatever the treatment regimen is that has been particularly diagnosed for them, that they're there to help even with household chores or.
Yes, we're so lucky to have so many coalitions. Not every, you know, town has one.
Yeah.
But patients are undergoing surgery or radiation or chemotherapy, you know, might just need a little extra support during that recovery period or while they're undergoing the treatments. And you know, they have the Lend a Helping Hand program where they're able to.
So what does that do exactly?
It's volunteers that help with different things, either a ride, you know, to your appointment for treatment. You know, if they need some help with the housekeeping or some food, you know, preparation, that sort of thing. These are all things that they provide. Maybe they need a little financial assistance with some co-pays and that sort of thing, you know, involved with the treatment. These are all things that they can help with.
That's really remarkable because again, I'm, you know, having been fortunate enough not to have gone through that, but I would imagine you're scared, you know.
Yeah.
But to have someone to talk to who said, well, let me take you to that doctor appointment, you know, to have someone there with you that has been through it and come through it well has really got to make all the difference in the world.
Yeah, it does. And I think that's why we've done so well in being able to get everybody the treatment that they need here. Yeah.
Well, we're very, very, very grateful for that, believe me. There have been some new advances. Can you share one of them?
Yeah, one of the advances is the way that we image the margins during the surgery. So there's a new device that's been out that uses fluorescent dye to take a look if there's any residual cancer in the cavity at the time of surgery, so that the surgeon can be guided in whether to take out more tissue or not, and then hopefully decrease the chance of having to go back.
That
for
second
more
time.
tissue, exactly.
Thank you.
Yes, it's something that we offer at Good Sam, which is pretty amazing. Yes.
Are there any, I know you said earlier about losing weight, you know, that obesity is a contributory factor. So any other particular lifestyle changes that we could recommend to people so that they are, you know, diminishing their risk for being diagnosed?
Yeah, just being more active, you know, really getting out there and getting your heart rate up, and exercising can make a big difference. Watching the things that you eat, you know, trying to stay maybe with the whole
Yeah.
foods and that sort of thing.
okay.
And like we said, minimize alcohol intake and other things.
That also seems to be the cure-all
It does.
for everything
There's a
out
lot
there.
of diseases
Lose
we
weight,
have.
exercise.
I know. It's easier
Yeah.
said than done.
Well,
That's for
listen,
sure.
I can't thank you enough for coming in. It's really been very informative. And I'm hoping that anybody out there listening or watching will book that mammogram appointment. So I thank you very much.
Oh,
Doctor.
it's my pleasure. Thank you
Thank
so
you.
much. Thanks
Thank
for having
you.
me.
And we will see you next time on Supervisor Spotlight.